Okay, everybody, welcome to the show. You're going to notice I'm in a different location today. I'm a guest in the studio with Dr. Erik today, and I'm thrilled to have him as a guest on the show. And I'm going to start off the way I start every show, which is I point out I'm just an elder law attorney. I don't do everything, but what I try to do is educate my clients and the people who watch this show as much as I can, because while I don't do everything, I'm happy to connect people with those who do. And today we have a wonderful guest. We have Dr. Erik, who is one of the leading doctors participating in an experimental Medicare program called GUIDE, which is Guiding an Improved Dementia Experience, that just launched in July of 2024. Very few people know what this is. So I'm really excited to be here with you today, Dr. Erik, so we can talk about, unpack what this program is, learn more about how people can benefit from it, how people can take advantage of these extra resources available to them. But let's start with the basics. Dr. Erik, please introduce yourself. Tell us about your background. Tell us about how you got into this.
Thank you. Thank you so much, Jason. Really happy to be on your show. Yep. You bring a lot of value to a lot of people, and so I'm really blessed to be here on your show. A little bit about how I got here. So I'm a physician by trade, and I started doing house calls straight out of residency. So straight out of residency doing house calls before it was popular. Now, it was popular back in the 50s, 60s, then it went away, and then we brought it back.
Wow.
And I did that for quite some time. I would say for around 10 years. Myself and many, many nurse practitioners who worked for me in New York and in Florida, really understanding what makes up a true patient experience, not just in an office for 5 minutes, but how do they live? What do they eat? What are their dynamics like? Who lives with them? How are the rugs in the home? Is there a tripping hazard? Is there enough food in the refrigerator? So a house call is a really...
That's got to be the number one complaint about doctors these days.
Yeah.
Is you go walk in, you get your 5 minutes with them, they prescribe something, boom, you're done. So you're really getting back to what matters to people. That's wonderful.
Yes. And you know that time we spend during house calls is anywhere, new patients are at 60 minutes to 90 minutes. So we're really learning about grandma and grandpa. Now, you've mentioned the GUIDE model.
Yeah.
Medicare has now understood that the focus is not just the patient. The patient is important, of course, but there's other things surrounding the patient. One of the biggest things are the caregivers of the patient, specifically of patients who have dementia. Now, I always say these stats, interesting stats. In 2020, in Florida, 580,000 people were diagnosed with dementia, right? Regular dementia.
Yes.
With Alzheimer's disease, actually, specifically Alzheimer's.
Right.
In 2025, there are 720,000 people diagnosed with Alzheimer's disease, right?
Yeah.
That's a 24.1% increase.
What's going on?
So that's an interesting question. Now, on top of that, what's going on? Physicians, 40% of physicians have said, primary care docs, we don't feel comfortable or don't have the tools to make a diagnosis of dementia. Now, you think about that. I said 720,000 people with Alzheimer's disease diagnosed.
Right.
What about the 40% of doctors who feel uncomfortable making the diagnosis?
We're shorting these numbers.
Right?
Yeah.
So now you're thinking, okay, well, how many caregivers are there? There's more than 1 million caregivers just in the state of Florida. Caregivers meaning unpaid.
Unpaid caregivers.
Unpaid
That's
caregivers.
Right.
Okay. 66% of these caregivers themselves have chronic medical conditions.
It's often the spouse who, if you're elderly and you have dementia, it's the spouse taking care of. So it's oftentimes the 90-pound soaking wet wife taking care of her heavy husband and trying to figure out how she's going to shower him and feed him and get him dressed. And this is a crazy system that we're living in.
Yes. And more than 30% of caregivers actually have depression. And one would think, listen, you know, the lifestyle, taking care, all the stress.
Right.
So Medicare they said, look, there's a problem. How can we fix the problem? Well, let's do this pilot. It's an 8-year pilot. It's called the GUIDE model. We're not going to open it up to every single provider. We're going to be very selective. For example, here in the state of Florida, there's only 30 of us. Right? For 720,000 people, only 30 were selected. Okay, great, you say, Dr. Erik. 30 of you. What do you guys do? What do you offer? What is it?
Yeah.
So the GUIDE model has 2 specific tracks. One is the caregiver.
Okay.
One is for the patient. Let's start for the caregiver.
Yes.
So You, Jason, are the caregiver for your 80-year-old grandmother.
Sure.
Right? So you're like, okay, you're taking care of her. Now you are exhausted.
Mm-hmm.
You're tired. You're like, man, I'm so burnt out. And there's no resources to really help you. Medicare came in and said, no, Jason, you know what? We're going to send Dr. Erik's team. Dr. Erik's team is going to do an assessment, ask you, Jason, you personally, a whole bunch of questions that are studied questions. They're questions that are studied assessments.
Yes.
So let's say, Jason, you're exhausted. We come to the home, we do an assessment, and we do something called the ZBI, the Zared-Burtz assessment, where I'm asking you questions.
Right.
And I see on the scale, ding, 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 yes, moderate to severe burnout.
Okay.
What are your options? 3 options. Medicare allocates a specific amount, that's $2,500, to now one of 3. One is home care.
Okay.
Dr. Erik and my team, Med Better Health,
Right.
would be paid by Medicare.
Mm-hmm.
We contract with a home care agency.
Okay.
We're not allowed to take anything of those funds. It's a
Right.
direct pass-through.
Right.
And you're dealing with Medicare, federal funds, so there's no monkey business. It's all straight, right?
Right.
And we would take those funds and pay a home care agency to say, you know what, Jason, why don't you need 4 hours a week just to
Right.
relax, go play billiards, play
Right.
golf, spend
Sure.
time with your fam? We got you. We're going to pay from Medicare because you are eligible. We're going to pay this home care agency to come to your home
Okay.
and take care of grandma or grandpa when you're not there for those 4 or 5 hours. That's
Right.
one option. The other option, you're like, look, Dr. Erik, I would love for mom to go to an adult daycare. There are specific adult daycares for patients who have dementia.
Sure.
Because if mom for a day a week goes to an adult daycare, I get some time off and I
Right.
get to relax during that time.
Right.
Not a problem. Medicare pays for that service,
Right. Okay.
which is incredible.
Okay.
The other thing is respite. You, Jason, have a wedding in New York of your son.
Mm-hmm.
But you're like, look, it's going to be a 7-day thing.
Right.
Grandma, grandpa, they depend on me. I don't know where to leave my grandma. Not a problem. There's respite for that, meaning you could take your grandma. We can have her placed in an assisted living, temporary, 7-8 days.
Right.
You have the wedding. She's taken care of. She's getting
Right.
the food, the medications, the care, right?
it.
You feel comfortable.
Got it.
That's the one aspect. That's the respite
And
for
we can
you.
mix and match these different respites up to the $2,500
Correct.
limit per year. I
Correct.
believe it is. Okay.
Yes. You know, another question that a lot of
Yep.
people ask, and I'm sure you're
Yep.
thinking about, is, well, who qualifies?
Yes.
How do I know if my mom or my dad qualifies for this? 2 things. Number 1, the patient needs to have a diagnosis of dementia, right? An established diagnosis of dementia by some other doctor, a primary care doctor, a neurologist. Okay, very good. Number 2.
Now, if their doctor is not comfortable prescribing or diagnosing dementia, as we saw so many people are afraid to do it, can you get them to a doctor? We're not trying to make things up, but if their doctor just says, this is not what I do, I'm just a primary care doctor, how do we get them to the right gerontologist?
So we are actually within Med Better Health.
Yes.
We're able to diagnose someone with
Beautiful.
dementia as well.
Beautiful.
And that's important.
Yes.
So number 1 is a dementia diagnosis. Number 2 is from an insurance perspective. So Medicare came out and they said, look, has to be straight Medicare,
So no Advantage plans.
cannot be Humana,
No Part C,
Aetna,
no Advantage plans.
no,
Got
cannot be any of those. Cannot be in hospice. You know, I don't want to talk about too much about Medicare Advantage plans,
Yeah.
but our experience has been that the Medicare card
Yes.
is a golden card for a
Yes.
patient. My grandma, she's 92.
Yes.
I would never switch her to
No,
anything
For sure.
ever.
For sure.
So that's one thing. You have to be in straight Medicare, Part A, Part B.
Correct.
Cannot be in a Medicare Advantage plan. Cannot be in hospice. Cannot be in SNF.
Okay.
SNF meaning like a nursing home,
Right.
Rehab for long term, more than
Right.
4 months.
Right.
And you also, very importantly, like I said, hospice, no SNF, no PACE, no Medicare Advantage. Those are the disqualifiers.
And there's no financial criteria.
Nope.
Medicare in general doesn't have financial criteria, but I want to make sure this guide program also no income or asset requirements. Beautiful.
No.
Yeah.
So what the guide program provides from a dementia perspective, you, Jason, would be assigned and you would be given a care navigator. You have access to our team 24/7. So you can call and you can be like, grandma's not taking a shower. I don't know what to do. Now, traditionally what people do, people who are not trained in dementia care, be like, oh, she's getting old. She has dementia. Let's sprinkle some pills on her,
Right.
calm her down, and you could do what you want.
Right.
That's the wrong approach.
Okay.
It's a very wrong approach. In fact, many medications, and I'm not giving medical advice
Right.
here. I have an attorney here, on the bottom. This is not medical advice.
That's right.
But many medications such as Seroquel, quietapine, has a black box warning that says, even though it calms, it causes for like calming down,
Right.
it has a black box warning where it increases the death and the mortality in people who have dementia.
Right.
It's a fact, black and white. So if you really go into the issue, you would have access to a care navigator who would be like, well, Jason, I'm going to send you a 3-minute video, a skit on how you should approach grandma.
Oh,
well,
very
you'll be like, well, but
practical.
how?
Right.
Very easy. So it's 3 minutes. You watch it, then you and I will talk about it because I'm your care navigator. First of all, why does grandma not want to take a shower? Well, you're her grandson. Do you think she feels comfortable saying, hey, look at me? Maybe that's the issue.
Right.
Number 2, you're saying, grandma, take this off, do this, do that. People with dementia feel they're losing control.
They don't want to be infantilized.
Right. They don't want to. Exactly.
Right.
So also, they don't want to take a shower. So you have to say, grandma, when's the best time that you want to take a shower? You're giving her control. Why don't we not do a shower today? Do you want to go to the spa with me? We're going to make a spa experience.
Right.
You take the bathroom.
Right.
You make it very nice.
Put some candles. That's right.
Music. Everything's great. Then you say, grandma, I want you to say, what do you want to wash first? Here's the scrubber.
Right.
What do you want to wash first? Oh, I want to wash my leg first. Here you go, grandma.
Right.
Oh, now let me help you. Techniques like that
Wow.
make a world of a difference. One other technique.
Yes.
I always say the story. My dad and mom, they're 70. They live with my grandmother who's 92 years old.
God bless her.
Right? And they take care of her and everything. My mom is the daughter-in-law. Right? And there's a dynamic. She gave her life for Grams, right?
Yes.
But there's always, especially when someone has dementia.
Sure.
So my mom, I'm in New York visiting. My mom goes down to visit grandma in grandma's room, and grandma says, where's my mom? So grandma's asking, where's my mom?
Right.
Her mom.
Right.
And my mom wasn't trained at that time, so she, as any normal person, would say, grandma, your mom passed away.
Right.
But in reality, what happened? My grandma got upset. You always lie to me.
Right.
She's not dead. She's alive. You're a bad daughter-in-law.
Right.
Now, my mom hearing that's like, look, I take care of her. She's calling me a bad daughter-in-law. Her anxiety goes up. I come in, and this is a technique. I say, Grams, no. She went shopping. She's going to be back. She's not around yet, but she'll be back in a little bit. Hey, do you want to look at these old albums over here? Oh, do you know who this is? Can you talk to me? Yeah.
Yeah.
Completely redirected. Wow. Grams was not upset. Why? People say, well, no, you shouldn't lie to your grandmother. No. My grandmother and most folks with dementia, they are in their own world. I can't tell them. They have glasses, and it's completely different. Now,
it's their reality.
It's their reality. Let someone sit here today, right now, and say, Jason is not in front of you. I'll be yelling and screaming. What do you mean Jason's not in front of me? He's sitting right here.
Yeah.
That's what they see.
Yes.
So what we have to do is adapt and make them show like, oh, yeah, we're in your reality.
I love that these caregiving navigators are trained to do just that, because I don't think you get that just in the last 2 minutes with these examples. These are things that I've never even heard before of things to do, maybe things similar to it, but not exactly like that. To have access to someone 24/7 who not just sends you a video and says goodbye, but says, let's talk about it, let's role play it, and let's really make, that's a level of care that I quite honestly didn't think Medicare was capable of.
So when you say Medicare wasn't capable of, Medicare mandates that we provide 20 hours of training to anybody who comes on.
Wow.
And 10 of that is like didactic and then in the field. And that's just the beginning.
Sure.
We're training care navigators as we're going with this program. It's incredible to see them learn and them say, wow.
Right.
And there's so many resources available for people. Like outside of the guide, people think there's not a lot of resources. There's the Alzheimer's Association. They are great. They have a 1-800 number, 24/7, and they will tell you a lot of things that you need to know. There's the local area agencies on aging.
Yes, we deal with them all the time.
I'm sure. And those are the things that our care navigator will plug you into as the grandson.
That's great. So similar to what we're all trying to do, which is this is not just the service we offer, but we're going to connect you with other services that might complement what it is that we're doing. Okay, so now, practically speaking, people are watching this, are going, holy moly, I got the dementia diagnosis, I'm on original Medicare, I'm in the service area. Who do I call? How do I get started?
So definitely. So they can visit, and we'll put that down on the link, I'm sure.
We will.
It's medbetterhealth.org. medbetterhealth.org, and there's a specific guide model right on top of the website. You click on it, you put in a little bit of information, very little. We reach out to you. We look at all your criteria, dementia, all that stuff, and then we schedule an appointment.
And you're dealing with Medicare. The client isn't calling 1-800-MEDICARE and
Nope.
activating anything.
No.
You're dealing with, it's wonderful. So
Yeah,
you're
they just
getting it all
provide their
done.
first name, last name, date of birth, and Medicare ID, and we're able to see if you're eligible or not.
I love an easy solution.
That's awesome. Jason, thank you so much for the opportunity to be on your show. This is awesome.
Dr. Erik, all the best. Thank you. for being here.
Likewise. Thank you very much.